Hello everyone, welcome to another episode of HealthTech with Purpose. Today we have James Edwards joining us on our show. As a serial entrepreneur, James has co-founded companies in the hospital management, physician outsourcing, and telemedicine space and is mission-driven to support health equity and resolve health disparities. He is currently the President and Chief Strategy Officer at Cairns Health and an entrepreneur in residence at Startup Health. Join us for an exciting discussion with James talking about building successful healthcare startups on our show.
Hey, Jamey, how are you today? Welcome to the podcast.
I'm doing great, Ayush. It's a pleasure to be here and looking forward to our conversation today.
Yes, I too. This conversation has been pending along, and really excited to bring your story to our audience because you have really, seen through the different layers of healthcare in your experiences. We really wanted to capture that. But as we do that, why not we start with a quick recap of your different experiences in of the last 25 years, where you've built different companies, you're part of being different setups, and so on. So let's start from there.
Yeah, I'm a serial social impact founder, Ayush, and I've spent all that time really focused on the healthcare space. My first venture into it was being CEO of an ER hospice and anesthesia group here in Southern California. And I did that for 10 years. While I was there, founded another company called Cloudbreak Health that brought language interpreters to the point of care for limited English proficient and deaf and hard of hearing patients. And so I've really cut my teeth, if you will, on the provider side of healthcare. Never forgetting, right, that we're all patients, and understanding and seeing firsthand the problems that patients and providers have connecting. And so I've spent a lot of time in my career really focused on the fact that what we really need to do is build that connection, that every patient needs to be seen as a unique data point and a unique story, and not as part of the masses. That as patients, we need to have more compassion for the clinical teams as well, that are servicing us. So from that standpoint, taking care of us. So from that standpoint, after I had my health equity business that brought the language interpreters to the point of care, which I merged into a public company. I spent time at Startup Health, which is the largest digital health innovation ecosystem in the world. Had the pleasure of coaching and mentoring founders there for a number of years and helping architect their Health Transforming University program. And now today I find myself at another startup trying to do it all over again. And I'm at a Coastal Ventures backed startup called Koko Home. We're in the process of transitioning to a new brand called Cairns Health, Cairns Health. And we're excited to be at the crosshairs of what I would say are the two most important trends in healthcare today. The first one being having a rapidly aging population that we don't have enough clinical professionals to take care of. And then two, this hospital at home movement and the home becoming a locus of care. And so what we do is we have a AI assistant enabled with ambient sensing that we have by the bedside. And it can monitor the patient, monitor their heart rate, breathing rate, vitals, and then put the patient in context in the room. And we're right now applying that in the senior care space so that we can deliver care plans at scale and make them easily digestible and then ease the burden of the caregivers caring for these patients.
Okay, amazing, amazing. And as you speak, I think I see one of the devices right in your background. So
That's right. That's right. It's right there.
yeah.
Pointing at it right now. Yeah, that's Luna. Luna is our digital bedside AI assistant.
Mhm. That's amazing. No, do you talk, I think, about the two biggest trends in health, fairly right. But before we, jump onto that, I really wanted to piggyback more in a chronological order of the experiences that you had, especially since you've been mentoring a lot of health startups at scale.
Yeah.
So what are some of your, over the years, those three, I would say, go-to recipes for every founder, like three do's and three don'ts when it comes to building a health startup?
Yeah, just three, right? Like it's hard to kind of take all that wisdom and experience and all the mistakes that I've made and narrow it down to
Yeah.
just three areas, but I'll give it my best shot. It's been a real honor and a privilege to be at a place like Startup Health as an entrepreneur in residence. And while I'm there to really inspire those founders, I'm really inspired by their stories just as much. And it's amazing to see the power of community and how it can really be deployed in a way to help these startup founders feel like they're not alone and help each other. I would tell you that some of the lessons that I've learned over the course of mentoring and coaching those founders in my career are really like number one, align your product roadmap with the specific needs of your clients and markets. I think that a lot of times product gets developed in a vacuum. And as a result, you might develop something that you think the market needs only to discover that it's not what the market needs. So I'm a big fan of doing co-development partnerships and kind of this concept. I don't know if you're, a Ted Lasso watcher, Ayush, but he quotes, I think it's Walt Whitman, where he talks about being curious, not judgmental. And for me, that was like a great lesson. As opposed to having a preconceived notion about the way something should be done, having that curiosity to really learn what your clients' needs are and not judge them for how they're doing things currently, but rather ask them why they're doing that. The why is really important. Helps really guide a lot of product development that can be really productive. And then at the end of the day, if you're doing a co-development partnership, that whatever you're developing is going to have a market because you're developing it for that market specifically. And so it's nice to know that once you're done with the development process, there's going to be revenue at the end of that rainbow. And then, finally, kind of on that aligning of the product roadmap, like money and mission are really linked. And money tends to follow mission and it follows impact in healthcare. So when you're doing your product roadmap, design that product roadmap for impact. And if you're very successful in doing that, the revenue and funding and everything else will follow. So that would be point number one. Point number two on the do's, I really think is in healthcare, direct-to-consumer healthcare is really difficult. And I'm a big fan of leveraging other people's networks to build their own. So, and I really cut my teeth. So I'm a little bit biased on B2B in healthcare. And I think it's a great place to start as consumers frequently aren't the one paying for their healthcare solution. It might be their insurance company, who's doing it or their employer, but typically it's not them. So if you really want to build scale, going to that end consumer can be really expensive. It becomes kind of like a CAC versus LTV type of discussion. And I think in healthcare, things are just operate a little bit differently. And you can effectively grow your business and grow your own network by leveraging other people's in a much more cost-effective type of way. And then finally, it's kind of about great storytelling. How do you make your solution simple and relatable? Healthcare is super complex. All these stakeholders are operating in this environment of overwhelming complexity. And so how do you make that simple? How do you make your solution really easy to understand? And even if your solution demands sophistication and complexity, right? Like AI and big data and all these things that under the water, it might be that duck paddling furiously at the surface. How do you make it simple and do it with really great storytelling? So those would be my tips.
Yeah, fair enough. Fair enough. A quick follow-up question. You mentioned about co-development partnership. For a startup person, are they easy to get? Are there ways that one can quickly get these partnerships, or that's a pain in itself? Because what I imagine a co-development partnership would be with some sort of an institution, a
Yeah.
provider, or a payer. But how have you seen this market? Like, is that possible quickly for for a founder, or does that take its own time?
Yeah, the answer is, and I'm sure you were expecting this, is it depends. I think from our experience that we have here at Koko and Cairns, we've very quickly been able to secure co-development partnerships because the work we're doing really resonates with them. And we're selling people on this vision of what the solution could be, and we're connecting the dots, right? You have to be able in this scenario to tell that story, connect the dots, and really bring people onto your side of saying, yes, I would love a solution that does X, Y, and Z. So we've been very successful in doing that. We've already secured 3 co-development partnerships. One is in conjunction with an NIH grant that we're working on with Indiana University Health and others to develop an Alzheimer's use case on the platform. Clearly, a major and important issue that we're trying to solve there. Another co-development partnership is with a remote patient monitoring company. And with them, we are working on helping them develop a better level of engagement and a better experience to kind of decommoditize that experience that they're having in that solution. And then finally, we're working with an independent living and assisted living business to improve their overall user experience and help them solve what are labor staffing issues and those types of things by deploying the AI as part of the care team. So for us, it's about hitting on the key points that really matter to that. And you can see it's like across different industry sectors or sub verticals that we're operating under. But we're really trying to figure out what matters to them and then say, let's work on a solution that we know is going to move the needle for you. And I think if you do that, there's a lot of people that are looking to actually move their businesses forward, move their solutions forward, provide better care, better outcomes in a more efficient and cost-effective way. And if you can speak that language, I think those co-development partnerships are out there.
Okay, that's good. But tentatively, what kind of timeline is a reasonable time for a founder to be able to assess, whether this co-development partnership is going or not? Because, sometimes what I can imagine is it could be stuck in a limbo. So it's like a yes, 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 but there's no real contract or like a substantial action really happening. So, what would you say, like a reasonable measurable way for a founder that they're going in the right direction, especially regarding the product market fit? Because the worst thing you want to avoid for a founder is not to invest time into something that's, that could end up like wasting the effort and the time that it took.
Yeah, I think the best co-development partnerships are when you've got a team who actually understands the market well enough to develop what I would consider on their own some core infrastructure. Like that in healthcare you're going to need to develop a HIPAA compliant infrastructure and a database and a web app and a front end and a back end and all those different types of things. So my recommendation is you do some of that work in advance. You don't start from square one or zero with a co-development partnership. You've got a general idea of what you want your product to be, and the co-development partnership is really about the last mile of that solution. It's about sitting there and saying, okay, well, I know that this is the general area we want to operate, and I've got my basic platform built, but I want to apply it for a specific use case. What's the best way to do that? So while there is development work, it's also more about configuring what you have than it is about developing a brand new solution from scratch. So I found that to be a successful strategy. And then from a timeline standpoint, Ayush, it ranges. It could be a situation where very quickly you can test your product and nail that use case. And frequently in the private market with commercial businesses, that can happen more quickly than it can in an academic environment, as an example. And it also depends on the goal of the co-development partnership. The work we're doing with Indiana University, the goal is to do a study and really produce some clinical outcomes that we can report off of that are really going to bring value not just to us, but the entire industry. Whereas the other two use cases are really about specific commercial use cases where we can configure our system to meet a specific need. And that can frequently happen much more quickly than doing that clinical study.
Mhm. Fairly said, fairly said. So, Jamie, let's move to the don'ts of a founder
Ah,
if you have. So, any learnings from others' experience as well as your own experiences that if you're doing it today, don't do it this way.
Ayush, I think we all know just as much as we are defined by what we do, we're defined as by what we don't do, right? Equally as important. And so, again, as we've spoken about this product development, what's a don't? I mean, the logical don't is don't assume you know what the market needs and build your solution in a vacuum. I mean, that to me is critical. You've got to take market insights and turn them into, an actionable workflow on your platform and make sure you're providing that value and solving something that the market actually wants you to solve, right? Like health systems have problems, payers have problems. So important to target your solution to those problems, not develop in a vacuum. I think the second thing is when you take a look at the funding environment, VCs or any type of funder is really focused on recurring revenue models.
Right.
And so creating what I would say is don't create a usage-based model or a hardware unit-driven type of model where you're not developing a long-term relationship with your client. The idea is the better you know your clients, the more and more you can do for them. And so thinking longer term about recurring revenue and how you can really build that relationship is going to create a much more sustainable business in the long term and one that can create more impact, more value. And finally, I think what we've seen over the last few years is the market doesn't really want point solutions anymore. And if it is a point solution, it's got to be interoperable with other platforms. So I think you want to target your solution, if you're a founder, on, hey, what platform am I going to build? Or how am I going to integrate with existing workflows via interoperability? Don't just build a point solution, have that broader perspective in mind as you're building out your technology.
Right, right. In fact, the third one is kind of my mission, which is like building interoperability, because we believe in that. Like today, any founder should not be building like a standalone, because no provider really has the time to switch between systems. That's like the whole base of like introducing a new system. They don't want additional work. Basically, the new system should be reducing the work. So
And Ayush, it's about making, again, that's like something, interoperability is super complex. And
right.
when you take a look at the care teams of the future, you very well might have an endocrinologist from NYU Langone and a cardiologist from the Mayo Clinic, and then a primary care physician from Providence Healthcare, as an example. So, a
Mhm.
local Providence hospital. So, when you think about those types of things and structuring those care teams, and they all might be on different instances of Epic and aren't interoperable and aren't taking a holistic view of that patient, how do we create that? So the interoperability aspect of it is really important. And you actually have to think about the experience and how it works and how you're surfacing that data to not overwhelm the user and not overwhelm the physicians, but to instead create a very clear integrated patient view that those physicians can take action on from the insights they garner from the data.
Right, right. True that. I mean, can't agree more because that's exactly what I do. Like working with founders myself, and yeah, that's the whole view. Like, how do you bring everything together on one dashboard, on one screen, basically, and create value because of the cohesion. So yeah, so my next question, Jamie, where I want to touch upon is actually Coho and Cairns. And I would like to talk more about the underlying technology. So, what really piqued my interest is the unique use of radar technology that you are using, which I've not seen yet often being used. So, tell us more about the whole concept of radar technology and how it can be used to improve the remote patient care monitoring, and also if there are any other use cases of it.
Yeah, look, I mean, when I joined Koko Cairns, I was super excited to be working with cutting edge technology again. And so, what does that cutting edge technology look like? Well, it looks like in what we call intelligent ambient sensing. So that's actually using radar
Mhm.
to detect the patient in the room. And the radar isn't a camera in the room, so the privacy concerns are less, et cetera. But the radar allows you to monitor the patient really 24/7 without it feeling like it's interfering with their normal lifestyle. There's no need for a wearable, so you don't need to wear anything. But using that technology, you can detect heart rate, breathing rate. You can detect whether a patient, is potentially getting sick by using the different signals in the room. We can track sleep stages. There's all sorts of interesting information that you can garner from the radar to help, again, drive an insight and influence that patient's care plan. We know when the patient's getting up. We know when they're getting into bed. We can launch and trigger certain activities based on those behaviors. There are a lot of people in the world who might have a radar solution. This episode of HealthTech with Purpose podcast is brought to you by MindBowser, a product engineering and digital transformation company focused on health. At MindBowser, we enable health companies to build the future of health where accessible, equitable, and patient care.
We strongly believe that technology can empower a healthier world, and that's why we are partnering with healthcare experts like yours to make it happen.
Hi guys, thanks for listening to HealthTech with Purpose. Make sure to subscribe us on Spotify, Apple, and YouTube for more expert insights on industry innovation and transformation. And remember, share the knowledge.
Or they might have the audio solution, but no one is doing both. We're really the first people in the space to be putting the patient in context with the radar tracking what they're doing, and using the artificial intelligence and large language model on the other side to intervene and help guide their care plan. And again, this goes to the theme of making the complex simple. We're trying to take very complex chronic and acute care plans, break them down to their bite-sized pieces where the patient can actually digest them, and then have the patient then follow and adhere to their care plan as a result. So it can be things like medication reminders. Imagine a patient having a device by their bedside when they're doing prehab and then rehab for what might be an orthopedic procedure, a new hip, a new knee, whatever it might be. Being able to have that patient feel supported in their home environment is really the driver of what we're trying to do. And the Alzheimer's use case is of importance to us. And we think a great application of the platform because there's so much we can do with memory care, reminding the patient about what they're doing the night before, letting that consolidate overnight, and then reminding them again as they do their day planning when they wake up. It reduces their anxiety. It reduces the anxiety of the caregiver. Imagine the caregiver wakes up and it's like, your mom had breakfast, her vitals look great, and she had her therapy session with her therapist. How great to know that and breathe that sigh of relief as a caregiver. So those are the types of things that we're trying to do by applying this very cutting edge technology and making it almost invisible.
Right, right. No, definitely. Like the vision that you shared, I can think of like it's so important nowadays that like you're not only having a periodic data, but you are basically knowing like what's really happening in the life or in a day-to-day activity. And then once you're able to track that, you can create all kinds of interventions and so on. But out of curiosity, since you mentioned about the radar technology in such good light, has this technology always existed, or has this been an innovation that came in? Like, what's the background around using the tech?
It's really been the last few years where particularly even the intelligent ambient sensing has taken more of a front row seat, and it's still not widely used, not widely distributed, but it's definitely, there are more players in the space now. And people have been trying to do digital healthcare assistants for a long time, but I don't know that artificial intelligence, ChatGPT, was kind of where it needed to be, these large language models and the advent of them, until recently. So we're starting to see a lot more activity in the space. And Koko was an early pioneer. Koko used to be called a company called Totemic, and they changed the name to Koko. And now we're potentially rebranding again as we now really feel like we found the solution that is going to have the biggest impact in market. But this expertise is not widely held yet, but we're pretty excited about it because what it allows us to do is really put the patient in context. We talked about the patient's story before, right? This helps, all this information helps build that patient's story, and helps give clinical teams the information that they need to really make a proper intervention. And that's what this is really about. It's about building that connectivity and building that relationship.
Right. Yeah. No, it sounds amazing, really. Very excited. So what's behind the name, by the way? When you switched from Coco to Cairns, what's behind the names?
Yeah, there's a really nice story behind it. So our product designer, Akiko, designed our device right there to look like, how when you go on a hike, Ayush, there are these trail markers that are stacks of
Right.
rocks.
Yeah.
That was his inspiration for
Oh,
building the
right.
device. And he had told us, he's like, Jamey, I wanted to design the device that way because anytime I was on a hike and this happened, I knew I wasn't alone. I knew I was on a path. And it was so rich from a branding standpoint to be like, we are part of your healthcare journey. We are helping guide you. We're helping you feel not alone in this world of healthcare, that we had to rush to Google and say, oh my God, what are those things called? And it turns out they're called rock cairns.
Okay.
And Cairns happens to have AI right in the middle of the word, and we didn't see any other Cairns Healths out there. So
Nice.
we locked onto the brand and thought it was a great manifestation of our mission.
Okay. Wow, that's amazing. Oh, like, did you chase the story or the story chased you? It's like,
Yeah, right. It's like
it's like
life
that.
imitating art, imitating life, right?
Nice, nice. It's like manifestation getting through because
Yeah,
you got
it
AI
definitely
right there.
seems like it was meant to be, right? It seems like it was meant to be. So we're stoked about that. We'll launch that in the coming months.
Mhm. Great. So, tell us more about, your experiences with funding, your own experiences, as well as, some of the stories where you have been part as a coach and as a mentor. How does, again, what are the lessons for healthcare startups when it comes to getting funded? And again, the times have definitely changed as well. So, what's the new norm, what I would call in funding?
And Ayush, it's such a good question, and it seems to literally be the $1 million question for most startups right now. I don't think we've seen a market like we're currently in quite some time. In fact, I think we got very much used to like the go-go days of fundraising, and COVID really launched digital health into a completely new stratosphere. I think pre-COVID, the most funding that had happened in any given year was kind of 7 to 10 billion of funding, and that jumped up to 40 billion during COVID. And now we're back down to kind of pre-COVID levels when it comes to funding digital health startups. And I also think we've got this situation where the momentum that we saw in digital health between 2020 and 2023, we've now seen some of the bellwether digital health companies running into issues. American Well, Teladoc, right? They're not the public company darlings that they were before. And they're struggling with their own issues right now as they make transitions. I also think that we have just a really uncertain economy, and that we're in this very troubling national and global environment from a social standpoint. We've got wars in the Ukraine, what's happening in the Middle East. We've got an election coming up here in the United States that people think is pretty important. And it's a very disconcerting and uncertain and unstable environment right now, and predicting the future has become really, really hard in that regard. I think we've also seen kind of all those FANG stocks, Facebook, Apple, Netflix, Google, like all these stocks that were leading indicators for the economy laying people off. I think there have been some bright spots. We've clearly seen, NVIDIA and some of their healthcare and AI initiatives really taking off and having the largest market cap in the world right now at over $3 trillion. Pretty amazing to think of that we have $1 trillion market cap companies, but there still seems to be a general disconnect between investors and founders on what companies are worth. I think it's time for everyone to really get some religion, get on the same page. And I've seen a lot of startups simply run out of runway and close their doors. And I think it's happening more now than it has been in the past. And I think, even going back to the Silicon Valley Bank scenario that ended up happening, there was a prediction back when Silicon Valley Bank went under or transitioned and had their issues that 50% of the startups were basically just going to go away. They were going to run out of runway and not be able to raise money. And I think we're starting to see the front end of it.
Mm-hmm. So do you think it's part of a just a market cycle, or is that a shift that we need to get used to? Like probably the prior ones were more like an outlier and now this is the norm, or do you feel that this is just something that will pass away and we'll go back to the norm which we were used to in the past decade?
Yeah, so I think the answer is somewhere in between. I am a founder, so the founder part of me is naturally optimistic, but I also understand the markets because I was an investment banking and private equity professional for 10 years. And so my viewpoint is kind of in the middle. I think having some rationality in the market makes sense. I think some companies were funded that shouldn't be funded, that probably shouldn't have gotten funding back during the go-go days. And some companies were well overfunded and big bets were made on certain companies, all of AI, whatever it might be. I think the middle is the right place to be. I'm a big believer of like everything in moderation. And I think there's some great healthcare technology companies out there that are really moving the needle, having a great impact, and those companies will continue to get funded. I think the bar has been raised. And in the day where you used to probably, raise money off a napkin, I think those days in healthcare are probably gone. And people are really going to want to see great fundamentals in the business, great teams, great strategy, great vision, great storytelling, and people who have been there and done that, so that they know that there's a proven track record associated with these teams finding success. And I think those are the types of things that people are going to want to see.
So, follow-up question on this one, Jamey, like, what are your hopes on the alternate funding models apart from the VC funding. So, when if the VC funding is changing, it also calls for the question for, okay, what's my plan B or C? So, what is your take on the other models like crowdfunding or revenue-based financing, and or any thing else that you may have seen, and then which of these you are particularly bullish about, if any?
Yeah, look, I still think the angel market is pretty vibrant. And so I think what you're seeing are pre-seed rounds or seed rounds turn into seed extension or pre-seed extension rounds, and going back to those funding bases and being able to secure more capital. I think the institutional funding market in terms of venture capital, like there's just not as much money being put to work and the bar is high. If you're one of the businesses that can qualify for that, then you should pursue it. But I think there was a little bit of a fallacy back in the day where like every digital health startup is venture fundable, and that's just not true. Certain businesses aren't venture fundable. And by the way, certain founders would be happy not being part of the venture funding market because that means you have to be high growth and have great involvement from your VC board, et cetera. And maybe certain founders feel like they would better navigate that just by being in more control of their businesses and suffering less dilution. So there's pros and cons to both those models. I think we have seen the advent of crowdfunding, places like WeFunder and Start Engine and others. And I think people have found a lot of success with those models. I think that success is found when you've been able to have a great story that you can generate a lot of followership in the market. So if you're a company that's a startup and you've been able to build a pretty big social media following, or you've had a lot of press, then you can bring that to a crowdfunding market and have a lot of success. Mm-hmm. But if you don't have that, it tends to be a little bit more challenging in the crowdfunding market. Right. I also think that the family office market has been getting more involved in venture capital. And if you can align your mission with the mission of that family office, finding, a billionaire or somebody who sold a company whose daughter has diabetes and is very focused on trying to solve that issue, I think that can be really successful as well. Clearly on the non-dilutive funding side, and that's kind of like the punchline here, there's a ton of opportunity. The NIH has grants. There's, all sorts of different parts of the government providing grants right now that can be done in conjunction with academic medical institutions or not. But all those grant funding opportunities are amazing. And they're not just small grant funding opportunities. Some of them are multi-millions of dollars. Mm-hmm. And we've seen a lot of companies in the startup health portfolio have success on the grant funding side. In fact, I mentioned it before, we at Cairns and Koko, we've been successful in working with a partner, IDL, and securing a grant opportunity there. So there's definitely a lot of value in non-dilutive funding. And then I would say secondary value in that crowdfunding space.
Great. One thing, since you mentioned about, the angel funding scene, accelerators are important part of it. And, you have spent a substantial time of your career with startup health and,
Yep.
seen the whole accelerator space. Again, your thoughts or wisdom around, like how to choose the right accelerator or what things to look into, because of course, every accelerator is doing its best and probably great in its own means. But as a founder, like how to figure like which one to be part of and how to make the most out of it, because getting in is one thing, but then you also have to make sure that you are successful out of it, like you got what you were looking for, and not just getting in just for the namesake of it and thinking like some magic
Right.
is going to happen since you have just aligned with this brand name. So how to choose and how to make the most out of it.
Yeah, it's not enough to say you're a Y Combinator, Techstars, or startup health company. Like you definitely have to make the most of your experience. No one is going to hand you everything that you want on a silver platter. And even when you get into these programs, the programs are a lot of work, right? Mm-hmm. And so it really depends on what you're trying to accomplish. In a Techstars or Y Combinator circumstance, the light shines very brightly for like 12 weeks or however long the program is. And you get a lot of very intensive work done, and it does accelerate you forward. And there's a bunch of great mentorship. But then, once the 12 weeks is over, you become an alumni and you're kind of handed back your keys again. And you need to then keep that momentum going and find ways to do it. There are longitudinal programs out there like Startup Health but even Startup Health recently has migrated their model into what they call moonshot communities. And these moonshot communities, they specifically have partners for Alzheimer's and type 1 diabetes as an example, where they're specifically taking on like very focused issues, and they've assembled a great group of mentors and what they call their impact boards to support the companies as they're navigating them. But they're very like disease focused. So if you don't fit into that disease focused model, then like they're not taking applications right now for companies that aren't necessarily one of those moonshot communities. And they're looking to expand those moonshot communities in the future. And I think that model is really working for them because those companies get a 3-year experience with mentorship, support, and a community of people who are all trying to solve similar problems in a really collaborative and supportive way. And the power of that community is really valuable. So for me, I'm a big believer in the Accelerator model. Each one has their pros or their cons. And depending on what the founder is trying to accomplish, they need to be very careful with it. Some of the models come with investment rights. Some of the models come with actual funding itself in the beginning. And it really just depends what that funder wants. But they should take a long-term view on what they're trying to accomplish before considering any of the accelerators.
Great. Thank you for that. And my last question, Jamey, is the quote on your back, don't give up the ship. Yes. So talk about it. What's the, what's the meaning behind the quote and your story around putting this one as your background, or why did you choose this one really?
Yeah, look, I think in my time at Startup Health, and even when I was running Cloudbreak Health was a Startup Health, Cloudbreak Health was a Startup Health portfolio company. So one of the things that we always focused on, and I'm also part of a group called YPO, the Young Presidents Organization, and something that Startup Health and YPO have in common is just kind of this focus on mindset and the importance of having the right mindset as a founder, understanding that your growth as a founder is never linear. It feels like a bunch of roller coasters strung together between your milestones, and understanding that when you are at your worst and feeling like, oh man, I should just shut my doors, there's a light at the end of that tunnel and a community of people support you, and having the right mindset is really important. So this quote, don't give up the ship, is kind of always a reminder to me to not give up my mindset and how important that is. Because as a founder, it's really all that you have, and it's what you use not just to get yourself out of bed every morning, but to inspire those around you. And so, my one big piece of advice for any founder is make sure you've got the right mindset and make sure that you're doing things for the right reasons. And that mindset builds your meaning and your purpose, and not just your mindset, but surround yourself with others who have the same mindset as well, because you want your investors to have a similar mindset in terms of how they tackle their problems and solutions. Great companies, Ayush, are defined not just by what they do in times of prosperity, but what they do in times of challenge. And so you want to make sure you surround yourself and your employees and your team members with people who all have that same mindset as well.
Right. No, of course, these small things are what, add up and what makes a startup and what creates value. I mean, taking care of these small things, which say, a larger company may just overlook just because they are focused on the larger things. I think that's where the value lies. So again, totally agree with your thought. Thank you so much, Jamey. It's been a pleasure speaking today, and I believe there are so many wisdom nuggets that other tech founders building in health can take from this episode. Really appreciate this talk, and we wish you all the best.
Ayush, thank you so much. These conversations are important, so thank you for creating a platform where we can have them. If anyone wants to get in touch with me, I'm available on LinkedIn, and I engage there all the time, and also on Twitter. So looking forward to interacting with the listeners, and thank you for this opportunity.
Thank you. Our pleasure. Thank you for joining us on the HealthTech with Purpose podcast. Before you leave, make sure to like and subscribe on Spotify, Apple, and YouTube. And if you would like to see someone on this podcast, do refer to us. My contact details are in the description. Before I leave, I wish you stay healthy, stay curious, and keep building.